Hello, my name is Gill Coverdale and I am the Professional Lead for Education at the Royal College of Nursing. When Helen Donovan and I were asked to develop the special edition with children in mind, the current research and policy developments on mental health in children and young people, we were delighted. As community nurses, Helen, a health visitor, and myself, a school nurse, this was very dear to our hearts and minds. We know how vital it is that public health and the prevention of ill health, both physical and mental, are absolutely vital, and how one supports the other. And that there is no physical well-being without mental health well-being, and vice versa. The policy directives are clear that it is vital we promote mental health and well-being and prevent mental health crises, yet there is not the resources to do so, and the mental health professionals are overburdened by the number of referrals and the reduction in the number of health visitors and school nurses in particular, who are the first people to identify children's mental ill health, is most worrying. This special edition presents a range of papers from both the UK and internationally, which explore the importance of recognising mental health issues in children and young people and strategies to support and provide treatment interventions. What's increasingly important is that children and young people themselves are at the centre of any research or service development, and McSweeney's paper, More Than Just Characters in a Story, proposes a change in emphasis for truly involving young people as the authors and developers of research and services as being essential to achieve better outcomes. Sarah Sherwin, in her paper Supporting the Mental Health Needs of Young People, the Spatial Practices of School Nurses, discusses from a school nursing perspective how different types of space influence the support options available, and that school nurses need to be more political and empowered to be able to offer what's needed. Providing this kind of support in schools is a core part of school nursing, and public health nurses are clearly recognised as having the skills to do this. There's a growing awareness of the need for a multi-professional and societal approach from teachers and the wider community to be able to recognise early signs and potential issues to prevent more serious problems. This need for a whole school and societal approach is addressed in the paper, A Review of School Approaches to Increasing Pupil Resilience, a systematic review by Jocelyn. Alongside work in schools, it is as ever necessary to make sure that there is ongoing support for the family. It's essential to recognise the risks for children and young people where there is any sort of family breakdown. For vulnerable children in particular, where there is sexual exploitation, there are clearly recognised risks of mental health problems that can last a lifetime. Nick Frost's paper, Providing Support and Therapy for Victims and Survivors of Child Sexual Exploitation, looks at the challenges of getting sustained therapeutic interventions in place to support victims in the long term. The World Health Organization has implemented the Global Mental Health Atlas, providing information from 177 countries on progress towards achieving the plan's targets. The key issue is that greater and significant investment must be put in place to expand services that are seen to work. This takes Helen and I back to the importance of prevention of mental ill health and the promotion of emotional well-being and good mental health. One of the key themes in this special issue is the importance for children and young people to have effective and meaningful relationships which help them to navigate through the stresses and life expectations. These are through parents and the wider family to schools and clubs and friendships. We're delighted that we have engaged several authors in our quest to provide you, the reader, with an enjoyable and interesting special issue, and we truly hope that you agree it is a worthwhile read. Thank you.